after listening to 3 wonderful lectures, I'm getting butterflies in my stomach. I don't know, but I'll cut it short. I remember Professor Subramaniam. I was taking a class for BSc students at Yoga University, and he was on his rounds, and he saw me taking the lecture. So he came inside and he said, "Can you define prana?" Oh God, at that time I was, even now I cannot, I'm sure. But at that time I trembled. But that made me read and read and read and discuss. And thank you so much for that. And Raghuramji, when he mentioned Shastriji's, I'll never forget his, Sukha Dukha Pariksha. He always said that. And that is ringing in my, in my brain cells, millions of cells. So that will be there till the last breath. And Shivaram, how beautifully he showed all the results of so many research. It's not easy to do a research, scientific research properly. So I just want to say a few things. How women are different from men. You must respect us at every moment, I should say. Because our feelings and emotions, they change. How do I want to see you and I want you to see me. Okay. It's
Would you like to sit
No,
down?
I feel, as a yoga practitioner, I must show that I can stand and speak. So how are we different? At every stage of our growth, starting from the unborn baby, to the newborn, to the puberty stage, adolescent period, and then of course your marriage, and then go through all that pregnancy period, and then of course you progress, and then menopause and the old age. At every stage, our adaptation to the environment, to our body, hormonal changes, immunological changes, endocrinal changes, so many, every cell changes. And we have potential at every stage. We are using hardly 8% of our potential. And women, we have so much of potential. We can give birth to a life. Can men do that? So far, science has not found that men can also give birth. So, how much more we have to, adapt at every stage. And especially now, as all the speakers said, the stress level are going up and up and up. Even an unborn child is stressed. An epidemiologist from Southampton, David Barker, he did a cohort study about 3,000 pregnant women during the World War. Every woman was so anxious, so much of fear, and so much of anxiety. What will happen to me? What will happen to my baby? And he did a scientific research, and he proved that most of the women, why most, 90% of them delivered low birth weight babies. It's called intrauterine growth restricted babies. They have potential, but because I'm stressed, the baby cries. I want to come out. You are not treating me properly. Your hormones are harming me. That's why, as you said, samskara, our pregnant women, how important it is to follow the 3 cardinal principles. I won't talk too much because it's already late and Prabha has already given this thing. But I would like to share some of my experiences. Calming the mind, slowing down the breath, then relaxing the body. Only 3. If at every stage of a woman, if she can do this, I'm sure we'll all be very healthy. And we can make others healthy also. So just mentioning a few things, I just want to say, yoga is like, at the very outset I wrote it down. I have to thank Prabha for inviting me to be here and taking me as one of the, members of Yogabharati. I'm so grateful to them because she has made me feel young, go through the Patanjali Yoga Sutras once again, go through the Bhagavad Gita because such brilliant audience, I can't say just a few things. It has to be authentic. So I read a little bit of Gita, Yoga Vasishta, but I still feel, one word about yoga, which I would emphasize. Yoga is like a dam across the turbulent river, and it stores all the energy. That's why we want yoga. Especially pregnant women have to do yoga. He was my PhD student when I was doing teaching PhD, and now he's going to be the Vice Chancellor. He is the Vice. Oh, congrats. See, such brilliant students I had. And so it is like a dam. It stores all the energy. And when you want it, during a dilemma, or during something that happens in your life, you can open that. That is what yoga does. It's like a dam. Even small babies, we had babies like attention deficit hyperactivity disorder. And they are hyperactive, as you know. They go and pull and do all sorts of things. And when we taught them in upside down postures to just close their eyes. That's all we did. It was very difficult for them to close their eyes, but they had to balance in that position. They closed their eyes. It was a marvelous, even for a 6 sessions, we could see the magnificent transformation in them. They became so quiet. And parents came and said, "ಏನು ಮ್ಯಾಜಿಕ್ ಮಾಡಿಬಿಟ್ಟಿದ್ದೀರಿ ಡಾಕ್ಟ್ರೆ, ಇಷ್ಟು ಚೆನ್ನಾಗಿ ಅವ್ರು ಎಷ್ಟು ಸೈಲೆಂಟ್ ಆಗಿಬಿಟ್ರು." Oh, it was such an achievement. Even my PhD didn't give me so much of pleasure. And, as I said, the different stages. I won't go into the details, but women are prone to so many disorders like menstrual disorders, urinary incontinence, and especially now they are having what is called as PCOD, PCOS. It has become a syndrome. It has become extremely common, and we are yet to find the cause for it. And yoga has helped remarkably to cut down their symptoms and even bear children, because amenorrhea is one of the important first symptom that they'll have. So PCOS and uterine prolapse, which has become common now because they are hardly doing exercise, as they were mentioning. They sit and sit all the time, or they bombarding millions of thoughts coming to your ear. At this stage, I must say, emotion is not a single chintana or thought. Emotion is when the thoughts become repeatedly, either it's a positive emotion or a negative emotion, it becomes an emotion. Thought will pass off, because before it is perceived, before the cerebral cortex tells the hypothalamus, the thalamus, the hypothalamus, pituitary, goes to the limbic system, goes to the amygdala, it vanishes and another thought comes. So emotion is something which stays there. And all the primary emotions we all know. It was there in Kurukshetra time. It is here now, much more than what it was in Kurukshetra, because we are interacting with so many people, and so many workplaces, and so many people. Vivekananda said, you tolerate. He didn't say, just tolerate. He said, you accept. You accept their behavior, their religions, their philosophy. Isn't that wonderful? That's what Dalai Lama also said. He is a magnificent person. The moment you sit beside him, oh God, you will get that calmness. Some people have that aura because avರೆಲ್ಲ sadhakar, they have done sadhana. Some of us, we just, talk and read. Oh, in ಸ್ವಲ್ಪ ತಿಳ್ಕೋಬೇಕು, in ಸ್ವಲ್ಪ but we don't really practice. Yoga is only abhyasa. Abhyasa vairagya. No amount of knowledge will tell you. So, what we did, it's about my work. I'll take another 10 minutes. About my work, which gave me so much of sense of achievement, and I learned about human nature. I learned about nature. I learned about the family support. At this junction, I might tell you that Westerners are realizing the importance of family support in the way, when they have premature babies. Even today, they can't prevent prematurity, though they have so much of technology, so much of investigation. Nobody knows why the uterus throws out the baby so soon. What they do in the incubators, where they keep the baby, previously the parents had to see only through a window. And when they see, oh God, my baby is full of tubes, full of all this, illೊಂದು oxygen consumption, ಇನ್ನೊಂದು bilirubin, another one, so many, the whole baby is not seen. You see only those instruments. So how will they feel? What bonding will they have? They are so afraid. Can I look after that baby? can I give my love to that baby? So now, what they have done, they bring the parents inside the intensive care unit, neonatal intensive care unit, and make them feel the baby. Through that window, they can touch the baby. Isn't that wonderful? The moment you touch, because touch is the first sensation that the baby will learn. We, of course, we have forgotten to touch each other and even look eyes to eyes. Always the mobile is there or something is there. You hardly recognize somebody. Even if your teacher is coming, you hardly know because you are concentrating there. I don't say that the advanced technology is wrong. We have to follow, because especially in obstetrics and gynecology field, it has helped enormously. By doing a scan in the early stages of pregnancy, we have detected so many congenital abnormalities. And today you can correct it, I say. You can take the baby out of the womb, operate on it, if it's a surgical problem, put it back and allow the pregnancy to continue. Isn't that a wonderful thing? Einstein said every moment is a miracle. Everything is a miracle. Like that it's happening and people are doing this. And as I said, the family members come inside the intensive care unit. They know the problems of the baby and that bonding develops. So please, you're all young people. I think I have the authority to advise you. Please, I can tell a story here. Mother-in-law, father-in-law, they were there, they were together, got married. And then daughter-in-law said, no, we have to stay separate. You send them out. I can't manage them. I have different ways. I have different ways of, my plans for my family. Oh God, the in-laws, they were so unhappy, but they had to go. They were, very sad that such a thing has happened. And she had a baby. And within 1 year, she found that the baby was not eating well, not growing well, and always very, very, inactive or something like that. So she was a MA professor. She wanted her baby, even at the age of 6 months, not to soil the floor, not to do any dirty work. If she had a potty, the baby had to sit on the potty and do all the dirty things. She and the baby became so afraid. What is this? Because that baby couldn't be natural. She won't get the control of the bladder and the bowel so soon. God has made us in a very different way. The milestones are very different. You can sit only at 8 months and stand at 1 year. She wanted everything to be very early. And what happened? The child became malnourished and very not at all active. Then she thought of her mother-in-law. I think I must call her back. I can't handle this. So one day she called her. Please, can you come? Oh God, she rushed. She was waiting for this. Nin please and tell Beckama, I'll come, it's my grandchild. She came rushing, and poor thing, she hugged the baby like, it's her own blood. It's her own blood. And then she treated the baby as a baby. She put all the potties under the things on the atta, put a mat, and oh God, I am not exaggerating, this happened because none of us could find out what was wrong with the child. It's all the mind. And the baby was, you can hear the laughter from a distance and the bonding that they developed. It was most divine, I must say. This is yoga. This is yoga. Deepak Chopra said, see, we are breathing the same air. I am throwing out the same carbon dioxide and you are inhaling that. We are all in this, taking the same gases and listening to the same thing, seeing the same thing. How can we be different? How can we have such likes and dislikes for small little things? So, yoga has to teach us to unfold our higher centers. There is lower brain, as Shivaram was saying, upper brain, and we are acting only through the lower centers. We are not giving time for our, upper brain to analyze. And what is our own nature is our joy. We are born with joy. We are born with compassion. We are born with bliss. And we have forgotten, as all the speakers mentioned. So a few experiences which I had with my, pregnant participants. I screened about 3,000 pregnant women in a wonderful nursing home setup, very well advanced maternity hospital. There they did the first test tube baby. And oh God, all the doctors, they are always so, so energetic. And I screened, and then at the end, many of them went away for delivery to their mother's place. I'm sure that's a good thing to do, but for my research, I couldn't get the end data. At that time, there was not so much of, communication facility. So I didn't know whether it was a cesarean, whether it was a normal delivery, whether the baby's weight was normal. So many data I had, so many parameters I had. Is it a premature baby, mature baby? But yet, my research paper was the first I think in whole world, nobody had done yoga in pregnancy. Now every maternity hospital has got a yoga wing. Those days I had to beg each doctor, go from maternity hospital to maternity hospital. If something happens, they will take me to the jail. You will not be affected. So I pleaded, I begged, because I said, being a pediatrician in that hospital, if I don't use this opportunity, who else will do it? So it was not easy, but I learned and learned and learned. Every case, if I can make a huge book, every participant was unique. And one case, I must say, one girl with severe asthma, she couldn't even sit on the floor. And parents were very angry with her because abortions after abortions. So they even said, we will get my son married. You can go anywhere you want. We'll get him married again. How should she feel? How should she feel? So she came, and I said, okay, Ma, you sit on the chair. Just watch others do it. And believe me, her asthma went off. She could sit in Padmasana, and she could, because we used to tell them a little bit of concept about Taittiriya Upanishad, Patanjali Yoga Sutras, the do's and don'ts, and the happiness analysis. Within 5 minutes, they understood that they were motivated oh God, there's so much. This not just asanas. There is so much. It's not just pranayama. What pranayama does to the body, we explained. So eventually, to cut it short, I had beautiful results. The birth weight came up. Premature delivery was very much less. Cesarean sections were very much less. And the complications in the mother, like hypertension, like thyroid, like diabetes, like cancer, they also came down. So that has been published in the International Journal, Alternative and Complementary Medicine. So we were very happy. Dr. Nagendra and Nagaratna were so happy that it came out. So I think I must conclude. So my only plea with all youngsters here, please, please, there is so much research going on in the nervous system and the brain. We still are just infants in the knowledge of the brain. Please do research, see which emotion you said in the limbic system it operates, like that, which anger, where does the center, affect that particular center, like that, moha, mada, matsarya. These are the major emotions which we have to control. So please see that samatvam and kaushalam, karma kaushalam, come into our life, and people who are with us with this. Thank you very much for giving me this opportunity.